Hello and welcome to my channel. This is a channel all about the history of spirituality and religious movements. And if it's your first time here, a very warm welcome. Thanks for being here. And if you're a subscriber or a current return visitor, I want to thank you so much for supporting the channel. Today I'm going to talk again about the Amish community. I have one other video about them and I'll leave a link in the description box. I'm going to start with a disclaimer that I'm not a doctor, I'm not a medical expert, I'm not a great specialist on genetics. The information that I'm going to be sharing comes from research about the Amish people. Well, I want to start today a discussion about some health issues in the Amish community. And first, I want to begin with the good news. Because of the Amish lifestyle, their simple lifestyle, they found in studies, particularly in Ohio and Indiana, that they have a tendency for better health. The overall cancer rates for the Amish were at 60% of the age-adjusted rate in Ohio and 56% of the national rate. And tobacco-related cancers were at 37%, and the other cancers at 72%. So the Amish are protected from many types of cancers. There's very little tobacco or alcohol use, if any, and limited sexual partners. And they may have genes that may reduce their susceptibility to cancer. Even skin cancer rates are lower, although many of the Amish work outside. They wear appropriate clothing to cover their skin, long sleeve shirts, long pants, and wide brimmed hats. So they're not exposed as much to sunlight or the UV rays as we would think. In a study in Indiana, I found this one particularly interesting. The prevalence of asthma in the Amish was as low as 5.2%. And in a Hutterite school children in their community, which was in South Dakota, it was at 21.3%. And likewise, the prevalence of allergic sensitization was 7.2% for the Amish, 33.3% for the Hutterites. The difference was that the Amish did not use industrialized farming, where the Hutterites did. Well, I want to talk to you about something called the founder effect, because that's what causes this issue with the Amish people, because they are a closed population. That means they do not marry or breed with anyone outside of the Amish community. Now, sometimes that means the Amish community as a whole, but very often it means their select local group. And they came from a small number of founders. And when a portion of this population moves to a new location, as it has over the generations, the genes of the founders become more frequent in the resulting population. In other words, the gene pool is not large enough to protect from what's called the founder effect. Now, most of the immigrants, the Amish immigrants, are from German or Swiss German ancestry, and they came to the U.S. in the early 1700s, 1717 to 1750. If you remember from my last video, about 500 Amish arrived here, first in Pennsylvania and then spreading to some other areas. Their population, with just this small beginning, in 2021 was 361,635. And considering the founder effect, that has a profound effect on that population. And so they are prone to particular genetic disorders, especially under the Old Order Amish. And we're going to talk about a couple of them, and some metabolic disorders and an unusual distribution of blood types. But I want to mention just two of these disorders, two syndromes which develop far more common among the Amish children than they do among the population in general. And one is Ellis van Creveld syndrome. And let me give you some of the anomalies that occur with this syndrome. This is a rare disorder, and it results sometimes in extra fingers and toes, and then also congenital heart defects. In a large number of the individuals with this syndrome, they're actually born with a hole in their heart. They have teeth present at birth, what is called a form of dwarfism, short-limbed dwarfism, meaning their arms and their legs are short in proportion to their trunk. Short ribs, cleft palate, and a malformation of the wrist bones. And all of this syndrome is caused by a mutation of one specific gene. There's another syndrome called Angelman syndrome. And this also is a genetic disorder, mainly affects the nervous system. The symptoms include a small head with a specific facial appearance. Now I'm going to give a list of the things that show up 100% of the time, 80% of the time, and then less frequently. So 100% of the time with this syndrome, there is developmental delay. Functionally, the person, although they may live to almost a normal or a common lifespan, they are functionally severely impaired. They also have speech impairment, no or minimal use of words, but they are receptive and communicate non-verbally. So their nonverbal skills, making signs and motions, and indicating their responses are higher than verbal ones. They have a movement or a balance disorder and behavioral characteristics as follows: laughter and smiling out of proportion. This is an anomaly. An atypically happy demeanor, easily excitable personality, often with hand flapping movements, and a short attention span. So they always have those things. Frequently, more than 80% also have, as I mentioned, delayed growth in head circumference. Usually by age 2, you see that. Before age 3, seizures can begin, and they have an abnormal EEG. In fewer, but some of them, there are also sleep disturbances, and interestingly, a fascination with water. I want to read you a description of them. Those with the syndrome are generally happy and contented people who like human contact and play. People with AS exhibit a profound desire for personal interaction with others. Communication can be difficult at first, but as a child develops, there is a definite character and ability to make themselves understood. They tend to develop strong nonverbal skills to compensate for their limited use of speech. It's widely accepted that their understanding of communication directed toward them is much larger than their ability to return conversation. So it appears that they understand what one is trying to communicate with them. Their problem tends to be in the response. Most affected people will not develop more than 5 to 10 words, if any at all. For both of these syndromes, there is no cure. There is only treatment to help them to handle their various symptoms and disabilities. For example, anti-seizure medication or sleep aids or physical therapy to help them to develop communication skills. So how do the Amish handle this greater number of children with genetic disabilities? Well, they do not want any kind of testing done on the fetus before birth. They do not believe in abortion, and in general, they do not practice birth control, but want large families. The family is the center of their life. They accept these children as being God's will, and they incorporate them into the Amish population the same way as they do their other children, compensating, of course, for their disability. They see this as God's will for them. And although they don't allow testing on the fetus, after birth, the Amish, most of whom do not have any kind of health insurance benefits, are very cooperative with the medical community who desire to care and help in the care of their children and to study them to help the greater population as we look at other possibly genetic conditions or genetically prompted conditions like dementia, Alzheimer's, and other diseases. And one of the other diseases being Parkinson's disease. So the Amish are helping the greater population as the medical community helps them to care for their children. Well, I hope you've found this informative and learned something about the issues of a closed religious community that does not consider marriage outside of the local community group. It has its challenges, certainly. Well, if you enjoyed this video, as always, I invite you to subscribe and give it a thumbs up. Please feel free to leave me your questions and comments, and also any suggestions you have for groups that you'd like to hear about. In the meantime, I hope you have a great week. I'll see you real soon. Bye for now.